Good morning, Namaskar. First of all, I would like to thanks Global Cancer Foundation, Dr. Rao sir, to invite me here, and from whole Ayurveda fraternity, I am thankful to Dr. Rao to give us chance to introduce Ayurveda in oncology in front of this august audience. Myself, Dr. Gaurang Joshi, and my wife, Dr. Bhavna. She has done her MD in Ayurveda oncology, and we are practicing at Rajkot, Gujarat. And it's my pleasure to introduce the overview of Ayurveda and oncology in front of you, respected chairpersons and co-chairpersons. Thank you again, and I will start with frontiers of medicine in Ayurveda oncology. Let's start with pray. Asato ma sadagamaya tamso ma jyotirgamaya mrityorma amrutam gamaya. Om Shanti, Shanti, Shanti. From the unreal, lead us to the real. From darkness, lead us unto light. From death, lead us to immortality. And Om, peace, peace, peace. Friends, Ayurveda is the science of life, and I think I believe that the roots of all this Western medicine is basically from Ayurveda, and I want to introduce the Ayurveda oncology. Today we'll discuss about the cancer, regarding Ayurvedic concept of cancer. Sign and symptoms, causative factors we don't want to discuss because all are the dignity of the Western oncology. So some research and some hopes that we are practicing for Ayurveda oncology at Rajkot. See, Ayu means life and Veda means knowledge from the Vedic text. And this holistic science is the knowledge of complete balance of the body, mind and spirit, including emotional and psychological on all levels. So this is the Ayurveda. It's having herbs, diet, exercise, yoga, aromas, tantras, mantras, meditation. So it's almost 5,000 years old science, but the cancer is already been described in Ayurvedic text. So many chronic diseases like cancer can easily come to stay with us and be our unwanted guests. And cancer was mentioned in ancient Ayurvedic text literature by the name of Arbuda. Arbuda is one of the surgical diseases and was explained in detail by Acharya Sushrut. You know, when the matter of Ayurveda comes, we must pranams to our guru or our acharyas like Sushrut, Vagbhat, Acharya Charak. Acharya Charak also mentioned Arbuda under the heading of Shofa. Acharya Vagbhat, he is also one of the guru in Ayurveda. He is also told his word that any mass bigger than the Granthi is called Arbuda. So types of Arbuda means types of cancer. Here again it's also described that regional metastasis, distance metastasis, this already described, and it's also that this regional metastasis already described by Acharya Sushrut that it's asadhya variety, means it's not curable. And also this is distance metastasis also described, this is Dvi-Arbuda, and it is also non-curable. So that is already described in Ayurvedic text 5,000 years back. Now in Ayurveda we have several types of cancer Arbuda, that's according to the location of the cancer. This is Sarkara Arbuda, Shwanita Arbuda, Mausa Arbuda, Karna Arbuda means ear, Asthi Arbuda means bone metastasis, Navarbuda means acute, and Jirnarbuda means chronic, the stage of the disease. It's already all these things described in Ayurvedic text. So these are the types of cancer that described in, this is also nasal cavity, paranasal sinuses, head and neck cancer, oral cavity cancer, this all the things has been described in Ayurvedic text. This oral cavity cancer. So incidence of cancer, 3 out of 10 may get cancer in 21st century according to World Health Organization. Now the patients or people using alternative therapies, this is the figure that shows that Germany 65%, Australia 59, Switzerland 52, France 52, Mexico and USA 50, 51. So that's the number of uses of the alternative medicine, including Ayurveda, has been increases globally. So there are causative factors according to modern science, as well as it's also mentioned in Ayurvedic text. So I don't want to touch this modern aspect because you all are the experts, but I wanted to touch the Ayurvedic concept. So now Ayurvedic factor. You know, Ayurveda is the science that believes in three types of dosas. It is Vata, Pitta and Kapha. And the 7 channels means 7 dhatus means Ras, Rakta, Maus, Med, Asti, Majja and Shukra. So according to the 3 doshas, if we are taking any kind of food or lifestyle we are living, that increases these dosas, and this kind of dosas or this kind of pathological factors that can create all types of cancer. So this is Vata factor, that is intake of cold, anactic light, non-slimy food. Tikta dominance means bitter taste. Pitta means taking spicy food or inappropriate food combinations. So these are the things. Some Ayurvedic treatments that's inappropriately conducted by the Ayurvedic doctors may also cause some of the cancer. So adoption of improper post-therapeutic dietetic program. Dietetic programs means we are doing panchakarma treatment, you know, everybody know about, and particularly in South, panchakarma is very popular. But if we handle it in inappropriate way, it may be the causative factor for such kind of cancer. Some external irritant, this also be described in Ayurvedic text. Some chemical carcinogens also described in Ayurveda text. Some viral factors. See, our Acharya was very well aware about this viral factors because they wrote this 5,000 years back. But still, they knew about these things. So improper, see, this is therapeutic, improper administration of olation, fermentation. This is the Ayurvedic panchakarma or associated panchakarma procedures. If we handle it in inappropriate way, that may also one of the causative factor for the cancer. Adoption of improper post-therapeutic dietetic program, pressure on gravity uterus, abortion, mismanagement. See, in previous years back, that's Ayurvedic doctors are also conducting this to deliver the childbirth and everything. So that was also, if Acharya Sushruta also mentioned that this is also one of the, if it handling inappropriate way, that may cause it cancer. So this is genetic factor is also described in Ayurveda. So a new fight against cancer, I would like to highlight some of the good herbs in Ayurveda. And we are also conducting few research projects how these herbs are going to be effective for the management of cancer, as well as integrated approach for the management of cancer with Western procedures like radiotherapy and chemotherapy, and with that we can integrate it with some Ayurvedic herbs. Ayurveda is focused on diet. You know, diet is the most important factor in our life, diet and lifestyle. So when diet is wrong, medicine is of no use, and when diet is correct, medicine is of no need. So we are focusing on diet. So this is one of the good one case we have case study we have done. In April 22, 2003, diagnosed with stage D2 prostatic carcinoma with multiple bone lesions, bilateral orchiectomy and standard estrogen therapy. The patients in August 24, 2003 adopted Ayurveda diet therapy. See, only Ayurveda diet therapy. And September 24, 2004, bone scan reveals virtually complete resolution of metastatic disease sites. November 2006, bone scan again negative. So this is the macrobiotic. Many macrobiotic practitioners show value and importance in research and wanted to have their benefits validated and experience acknowledged. So Atharva Ayurveda, an influential leader as a Ayurveda oncology in India, has communicated closely with many national and international cancer institutes and endorsed importance of research in this particular area of diet. So the purpose was to determine whether adoption of a plant-based diet along with macrobiotic lines and stress reduction and could slow stop progression of early metastatic prostate cancer. 12 biopsy confirmed patient with rising PSA level after surgery were recruited by radiologists at the local cancer centers, and patients and spouses were enrolled in intensive 6-month intervention taught and encouraged to increase intake of whole grains, vegetables, legumes, fruits, decreased meat, dairy and refined carbs and fermented food, engage in daily practice of meditation and yoga. Now, this is the modern treatment: surgery, radiotherapy, chemotherapy, biology treatment, and in Ayurveda also there are 4 stages of treatment. This is curative, one is supportive. This supportive is one can include the Ayurvedic treatment which can be used along with the modern treatment to combat their side effects and improve the quality of life of the patient. Prophylactic, in this one can include the rules of Swasthavrit, means good hygiene. Ahar, Vihar means diet and lifestyle in different Ayurvedic texts which are specially required to prevent cancer. Some palliative management is also one of the important aspects of Ayurveda, and various groups of drugs mentioned for increasing immunity, OJ, use of various drugs which known as anti-inflammatory properties and can also recommend it. In Ayurvedic text, Acharya Sushrut also mentioned about the surgery, complete resection with root and reconstruction with plastic surgery. So this is also described by our Acharya Sushrut. He was the surgeon of from Ayurveda fraternity, and local applications, hyperthermia, internal medications, metals, tablets, powders. These are the line of treatment according to Ayurveda. Supportive treatment and rehabilitation like yoga, exercise, meditation, microbiotic diet, because we know when the patient of cancer patient comes to us, they all mentally frustrated or depressed patient. So we need to increase the self-confidence of the patient at least to fight against cancer. So several new plant-derived natural products have proved to be of extreme interest in the treatment of cancer. And see, Taxol, which was isolated from the bark of the specific yew tree in 1971, which shows anti-tumor activity against a number of cancer. And the process of anti-cancer agents involves substantial time, effort and resources. For such achievement, no magic can help, but it is possible to do so by research work which requires keen observation, justified logic and deductions, great efforts and plenty of patience. So one of the wonderful drug in Ayurveda we are using ashwagandha, that is Vaidhania somnifera. That scientific name is Vaidhania somnifera solanaceae, and we at Atharva Ayurveda Hospital and Cancer Research Center India reported one study on the effect of Vaidhania somnifera on cellular immune response in normal as well as concomitant therapy with radiation. See, this is we can say a home remedy, that is ginger. It contains gingerol, and this compound has been known to effectively combat the breast, ovarian, prostate and colorectal cancer. So we can use it, we can advise to our patient to use these home remedies. This is garlic, is also, we can say it's home remedies, and it also contains very good anti-cancer properties. Turmeric contains a compound known as curcumin. This is now internationally all the research scientists has accepted, and this compound has preventive effects on lung, skin, colon, stomach, prostate and breast cancer. 1 teaspoon of turmeric every day is sufficient for the prevention of certain types of cancer. So just like an apple a day keeps the doctor away, the same things we can see this turmeric. Just a few spoon of turmeric can prevent certain types of cancer. Giloy, this is a wonderful herb that is Tinospora cordifolia, and see, it has the ability to reduce the solid tumor volume by 58.8%, so which is comparatively to cyclophosphamide and non-chemotherapeutic agents. So this immunostimulating properties can be used in the prevention of tumor mediated immunosuppression and hence could be a drug of choice for various cancers. So there are number of herbs that we can say Bhallatak is also one of the good herb for the anti-cancer treatment. These are the references. Now we are using these three main herbs, ashwagandha, shatavari and guduchi, that is sadabahar or immunomodulators. Even neem is also have some anti-cancer properties. So it requires a long time as I am providing just 20 minutes. So I don't want to discuss all the things in detail. Green tea is also one of the good anti-cancer herbs. These all are available in our kitchen. The art of medicine is to bring comforts and it is an art of loving and kindness. Research in Ayurveda Oncology. We are conducting few research, it's right now going on. Role of medicated enema for preventing or reducing the severity of radiotherapy induced bleeding per rectum bile skin reaction in any pelvic tumor. This is also right now we are conducting research particularly in the Basti treatment. And we have conducted one research that is for the side effect of radiotherapy in head and neck cancer with the ashwagandha, that is Vaidhania somnifera. In radiotherapy, X-ray particles are aimed at the tumor to cause the damage in the cells of the tumor. However, because of the location of the tumor, it is impossible to avoid some damage to the normal cells that are in the path of radiation beam. So this increase the loco-regional control and disease-free survival. So to combat the side effect of this radiotherapy, and most important aims to provide an agent to increase the radiation effect by this concomitant radioherbal protocol. So we used for that ashwagandha, Vaidhania somnifera, and this all the research protocol we have maintained. And 5 gram with milk 30 minutes before the external radiation we gave this ashwagandha to the patients. And some dietary schedule also we have established to the patient. Once the treatment was started, the patients were weekly examined for vital signs, symptoms, for overall condition, and weekly progress was recorded up to the total radiation, and final assessment for the efficacy of the drug was carried out. And this is the dietary protocols. Some showed the protect effect. One was with the respect to the vegetable consumption, it was observed that those who did not eat vegetables daily were at a significant higher risk. So every patient's advised to take vegetables and fruits. So out of 33, we have conducted with Vaidhania somnifera, and there are two groups, one without Vaidhania somnifera. So out of 33 patients, 12 patients, 36.6% developed mild reaction, 13 patients developed moderate reaction, and 8 patients developed severe reaction. And this is group B, and it also see complete resection response in 18 patients, means 54.54%. That is with Vaidhania somnifera. Partial response in 11 patients, stable disease in 1 patient, this is 3.03, and progressive disease in 3 patients. So it has been observed that the radiotherapy reaction appeared late during the course. There was sense of well-being in patients. Grade 3 and grade 4 reactions were less. The study is encouraging since ashwagandha reduces the discomfort and pain during the radiotherapy period. Patients tolerate radiotherapy in better manner. Discontinuation during the radiotherapy due to radiation reaction was less. So this is the positive effects of ashwagandha. So this is Ayurvedic combined modality of the treatment has improved local control in many clinical situations, and its most profound impact has definitely been on improving the quality of life of the patient, cancer patients who taking radiotherapy. It is hoped that a better understanding of
Sir,
the
your
clinical.
time is
Yes,
up. Can
yes,
you wind
yes.
it up,
Yeah,
please?
yeah. So use of antioxidant drug ashwagandha will provide a sound scientific basis for the improved care of patients with cancer. So these are the research we have done for this particular, and some non-drug treatment for the palliative management is also one of the important aspect of Ayurvedic oncology. Some good pain management herbs are available for Ayurveda. That is a matter of research. So this is non-drug medicine like simple massage, Shirodhara for the pain management of the cancer patients. So there is a limit for cure, for that is divine and we are not gods, but there is no limit for care and that is truly human which we are. So we help you to live a healthy life. We are Atharva, we believe in start living healthy. Ayurveda believes that prevention is better than cure. So we request all of you to advise the patients the prevention criteria according to Ayurveda, and this is a matter of integrative approach. So I would like to invite all these Ayurvedic, all these oncologist experts here, those who want to study some Ayurvedic research. We welcomes you to collaborate with us for this research for the benefits of the cancer patients. So thank you all.